Hi, I'm Hunter Alkonis with Men's Health Network, and I'm here with Andrew Hu from PCORI. We just finished up a congressional briefing on death rates and causes of death trends in the United States. Andrew, so what is PCORI, and what is kind of the health? What are the health issues that PCORI works to address and to correct?
Yeah, so PCORI is the country's leading funder of comparative effectiveness research, which is, as you know, and as we discussed, is about how do we compare various treatment options and interventions for that, and what's the best outcomes for that individual based off their individual preferences and needs. And we focus on a number of issues ranging from cancer, cardiovascular disease, opioids, and one of the things that's unique about PCORI is that we take a holistic view and we look at how things impact patients in the real world setting. So we look at the impacts on men. We looked at the impacts on women and different races. So races and ethnicities. So like we have a more realistic view of the effectiveness and outcomes of our treatments and therapies.
And what are some of the you probably mentioned today in your, as you mentioned today in your presentation, what are some of the findings that you guys have had that are impacting men more significantly?
So one of the examples is on prostate cancer. We funded a couple studies that kind of looked at the various options that men have when they are diagnosed with prostate cancer and trying to make a decision on which treatment option works best for them. So for many patients who have prostate cancer, they're faced with a choice of radiation, surgery, or even active surveillance. And what our studies did was compare the relative outcomes and benefits and harms of those options so that we can present information to the patient of what to expect based on what choices they're going to make and really help inform their decisions.
Awesome. Well, we thank you so much for everything that PCORI does. We've done a lot with PCORI at MHN, and you guys do a lot to forward the progression and the improvement of the health of men and families in general. So thank you so much for your help today, and have a good one.